Okay, so this baby's a little smaller than yours, but I thought I could show you what I think might be part of the problem. I noticed that when you were holding him in your video, you had him a little bit high on the back of his head, and his body was low, like this, and a little bit with the hips turned upward. I noticed he appeared to be looking for stability with his position. So I'm sure with a 3-month-old, you know, you've gotten into routine and everything like that. And we also mentioned that it started to be an issue early on. But I think, especially when we've breastfed older babies, it's like we have to start all over again with the basics of how to latch a baby on, because we may know exactly what we're doing, but the baby is still, you know, it has to start learning all from the beginning. So what I teach in the hospital especially is when you have your baby, you want to make sure his spine is straight and the ears, the shoulders, and the hips are also in a straight line. So this is how you want him to be totally straight and then facing all the way towards you. So when we drink, we also drink like this with our ears, shoulders, hips in a straight line. It's really hard to swallow like this. And I know that's not exactly what he was doing, but he was still twisted somehow with his lower body. So I would try to just go back to the basics, holding him, supporting his tush, putting your fingers behind his ears. This part of your hand goes between the shoulders to give him that support right here that he needs. And then again, you have the ears, shoulders, hips in a straight line. Your arm is essentially in line with the baby's spine also. And then the feet can be underneath. So because he is a big boy now, it can be really helpful to have a pillow underneath. And because I saw that you were trying to support him, you know, with your leg, I think that's more uncomfortable for you than anything else. And I think at this point he can use the more stability, make it as easy as possible for him. So if you mentioned you had a boppy pillow, if you have the boppy, roll up a towel like tight and put it right on top of the boppy, because a lot of times they kind of fall in the dent between the boppy and your stomach, and then the baby tries to still sink in there. So holding him really like on the same plane as your breasts are. And then I noticed that you were lifting up your breasts in the beginning to get him latched on, but it appeared, and this is why I wanted you to videotape the next feeding, maybe from your own angle or from this side, because it appeared that you were bringing him on like nose first. I'm exaggerating right now because it wasn't that much, but more nose first. So it's kind of like his head was more, his chin was close to his chest, right? And again, if we drink like this, it's not as comfortable as when we drink like this. When we drink from a glass, we move this up. There's a lot more space here for him to take the milk in, and just make it super easy. So see if you can even hold the breast while you're nursing for the next few sessions until he is getting it on both sides, because I know he will. It's just, I think his body gets tired from being in that position without being supported over here with his hips. So for the next few sessions, use the boppy with the towel rolled up, support the breast from underneath, and then how to latch him, just like with a newborn, there's reflex points here and here. So if you put your nipple right on that parking spot on the top of his lip, and then his chin on the breast, then instead of moving him over, or your breast like in his mouth when he opens only a little bit, you wait here, and then when he opens, when those reflexes are triggered, he will open wide. You leave the chin touching the breast in the same spot as if it's glued there, and you bring him over. So you're holding, and you're holding like this, and when he opens his mouth, you just move him over, and it's just only a little bit of a movement right here with his ears. So you don't want to hold the back of his head, because there's also reflex points on the back of his head that actually make him want to move his head backwards. So you want to hold here by the ears, between the shoulders, and if he's still looking down with his chin closer to his chest, the easiest way to bring him to open that up more is to use this part of your hand, bring his shoulders closer, because if he's like this and you're bringing the shoulders closer, then that happens, and his chin will go deeper into the breast. So you can push here, or you can move the baby over that way, leaving the breast in the same spot. So you want to keep holding the breast for him again, so that he doesn't have to use any muscles to hold your breast where he's latched on well, making it easier for him. So you could even use a nursing bra, or even a rolled up washcloth or something like that would function. So I think that's for positioning. One arm underneath the breast, one on the top. The other thing that I noticed is the nipple shield. I noticed that you just placed it on, and the opening was on more of the top of the breast, but his nose was more here. So ideally the nipple shield, the contact shield that you have, it has an opening, and that's supposed to be right where the baby's nose touches the breast, so he can smell you and touch you, and that makes it easier for them to keep going to the breast. So when you have a nipple shield, you want to turn it inside out a little bit, kind of like one of those Mexican hats. So you turn with your fingers. I don't have one here, so I'm just gonna, you're gonna turn with your fingers like that. So it's from the side, it goes like this, and then the top of the nipple shield, and then like this. So it's kind of inverted a little bit, but not all the way. And then you place it with the opening where the baby's nose is going to be. So if you have him in a cross cradle hold, it's going to be over here if you have him on this breast. So you put the opening here, you place it on, and then you kind of roll it off onto your breast. So part of the nipple is already inside the shield before you put the baby on. It will make a better seal, and it's more like breastfeeding, and it also stimulates you more. It's going to be better for your milk supply. So anytime you are using a shield, of course you want to make sure you pump also, or hand express. Hand expression can be extremely helpful. If there's an overactive letdown, you took him off, I saw that. What you can do is just place your flat hand straight on the breast and actually push in towards your ribs, so that overactive letdown goes down. Hold it a few seconds, and then you can put him on, and it will be just fine. It's a good issue, right? It's a good issue to have so much milk flow, so that's good. But he's showing you that he doesn't want it that fast. Another thing you can do is recline. So if you have him like this, you want to just lay back like this, because then gravity will first of all make a better seal, because his cheeks are on the breast. You want to make sure that both cheeks are touching the breast, and the chin is in the breast first, and then the nose is lifted up a little bit. And if you hold him like this, then the gravity is not going to push the milk out as fast as if you would be sitting like this or like that. So I hope that helps. See if you can videotape a little bit, or at least, you know, evaluate that and see what kind of questions you come up with, and then we'll talk again. Alrighty, bye-bye.